Good evening, everyone. I'm Chris Gutierrez.
And I'm Christine Noel in for Dominique this evening. That drug is called Remdesivir, and multiple trials indicate patients treated with it showed improvement quickly.
One of those studies is happening right here in Houston. Channel 2's Bill Barajas is live in the Texas Medical Center, where doctors at Methodist Hospital are on the front lines of this new research. Right, Bill?
That's right. And in regards to that study, there are several studies regarding that experimental drug, some of which Houston Methodist doctors are helping with. They tell us they are cautiously optimistic that the drug could help patients suffering from severe symptoms of coronavirus. It could help them recover. Doctors, researchers, and scientists have been working around the clock. At the center of their studies and trials, an experimental drug known as Remdesivir.
I think everybody, researchers, clinicians, government, hospitals, all institutions are really rapidly trying to find out what works.
The drug was initially used to treat Ebola, but turned out to be ineffective. It's now being tested for its potential benefits to patients with severe coronavirus symptoms. Houston Methodist Hospital is taking part in one of several studies.
We've seen patients that were critically ill and on ventilators get off of ventilators. We've seen people that were on their way to getting on a ventilator to actually not and getting out of the ICU and going home.
White House advisor Dr. Anthony Fauci says Remdesivir sets a new standard of care.
We think it's really opening the door to the fact that we now have the capability of treating, and I can guarantee you, as more people, more companies, more investigators get involved, it's going to get better. And
that optimism is trickling down to Houstonians.
That's what they call it, practicing medicine, right? They're trying it out, they're experimenting, and so, I'm optimistic.
There is at least one study, though, that suggests the drug is not effective.
The Lancet article was one of the World Health Organization studies that was in China. That study was stopped early, and that study was, in my opinion, underpowered to be able to make any conclusions from that.
And Dr. Grimes tells me they got involved with this study on March 16th. They enrolled 50 patients from Houston Methodist Hospital. Out of those 50, 30 recovered and were able to go home from the hospital. Live from the Texas Medical Center, Bill Barajas, KPRC, Channel 2 News.